And I think
Well, I'm on the list for mine at Kaiser.
yeah, everyone should check with your healthcare provider too if you don't qualify right now, because like Kaiser, for example, you can get in a waiting list right now, even if your phase isn't open, and then they'll contact you when your turn is up, so you don't have to play the game of keep calling over and over and over again.
Well, my age group is up.
Yeah. No, I just saying, obviously there's a couple of groups now that became eligible in the last little while, but I think there's also a lot of questions for people who are kind of in phase 2 or phase 3. So I know for Kaiser at least you can get in line, so you don't have to call.
You can get in line.
Yeah, one of the disadvantages to independent providers is that they're not in any of those networks. So you're just out there with wherever you can find what you can find.
Right. Yeah.
Well, they need to be working with their county, which is why Kathy was good. I think it's colorado.org/COVID-19.
It's now showing up in that.
COVID-19.colorado.gov.
Yeah, and all the large health systems are likely vaccinating people, even if you're not part of the system. It just might be harder to get a slot because it's all federal drug. So it's not owned by any individual health system.
Well, I was getting my car cleaned, and a woman who wasn't a Kaiser member called Kaiser. She was over 70, and she got her shot on Friday. So you're right. If you go to a big enough entity, you can get in line and get it.
Yeah, Arden here. I belong to UC Health, and they contacted me by computer and gave me an appointment, and I showed up last Tuesday and got the first vaccine, and I never made a call or had anything to do with it. Their computer just kicked me out and gave me an appointment.
And by the way, my husband got his vaccine the same way, Arden, last week, and he had no effect at all. I mean, no sore arm, no symptoms whatsoever.
Nor did I. It was so organized. Yes. I arrived early for my appointment. They took me right away. There were 3 people in line. I got the shot, had to wait 15 minutes to rule out a reaction and left. Right. It was just so smooth and so well organized.
Right.
That's awesome.
Caitlin, do you want to just explain to everybody, maybe they have an interest or not, that this is not a live vaccine?
Yeah, it's not a live vaccine. It uses new mRNA technology, but it's not new to drugs. It's only new to vaccine. It was used previously in oncology drugs. So the technology itself is not new.
But they're not injecting the live virus into
correct. No live virus, which means that even though like certain populations where live vaccines are a concern, like pregnant women, people who are immunocompromised, are still eligible to receive this vaccine. And then side effects really vary from person to person. I mean, I think we've heard a lot of people that had no reaction. I'll tell you, I had my first dose a couple of weeks ago, and I did have a mild symptomatic reaction. I had sore arm for a couple of days. I had achiness. But to me, I think anything that you get from the vaccine is very short-lived. Right. It's going to be, for me, like it's definitely worth that as opposed to like, because we don't know what COVID does either long-term. Yeah. So I get my second dose next week.
So did you get the Pfizer or the Moderna?
I got the Moderna. My dad's a physician and he got the Pfizer. So we've had both go through our family. My dad's had 2 doses of Pfizer and tolerated both really well. And he's an oncology patient. So he had a transplant last fall. So he's extremely immunocompromised still.
So Caitlin, I hear rumors that one can get their vaccine through Kaiser, even if you're not Kaiser, or through UCH, even if you're not UCH. Do you know how one would go about doing that?
Yeah, so for Kaiser, I don't know for UC because it's probably every health system put their own processes in place. For Kaiser, if you call our call center, they will give you have to get a Kaiser number to kind of be able to be scheduled in the system, but they will give any non-member a Kaiser number. You just have to call them and kind of go on the phone through the registration process. And we are definitely vaccinating non-members. We've vaccinated a lot of non-members so far.
I think Centura Health is also vaccinating, Deb. Are you in that?
Nope, apparently not.
Apparently not. Are you?
Apparently, even though I've had some procedures done with them, I'm not in their system, apparently.
Oh.
So,
But I think the hospital has the vaccine. So maybe call the hospital and see if there's some way you could get it,
yeah.
you know?
And
Caitlin, I have another question. I have heard some people talk positively about the Pfizer vaccine and not as positively about the Moderna. Do you know why anybody would question the two vaccines?
The two vaccines, from a design standpoint, are very, very similar. I think in studies, there were slight differences in side effects and like a 1% difference in efficacy. For me, obviously I didn't choose, I had whatever was available at the time. I read the 56 pages of safety and efficacy data of both Pfizer and Moderna. And for me, I felt 100% comfortable with whatever one was available. At this point in time with vaccine supply, I think vaccine supply is still extremely limited, which is why it's so challenging for people. Even I think like right now in this phase we're in, there's like 1.2 or 1.3 million people eligible or something like that. And we just don't have that much vaccine right now. I mean, so from my standpoint with supply, I was just like, I want whatever one I can get first.
You know, Caitlin, I was interested that the one vaccine has 30 micrograms of the antigen and the other one has 100 micrograms. And I don't understand why the disparity between the two, and yet they're supposed to be equally efficacious.
Yeah, I mean, I think the amounts really come down to how just they were studied. You know, when they started their studies, some study work even started before, obviously, COVID was a huge pandemic because they had preliminary work going on in case something like this happened. You pick amounts and you pick multiple different amounts and you kind of phase them out in your trials. So it comes down to just how they were studied. And now there's a lot of sub-studies going on examining like, are other doses efficacious from each one? Right. But yeah, I will say that the efficacy data of both of them seems to be excellent in the preliminary studies. And obviously, like once you get into large scale, like mass vaccination, those numbers might decrease a little bit. And we don't know they're studying now, both of them against the new strains that are out too. But yeah, I mean, I think it's hard to compare apples to apples just because, you know, they were all designed they all kind of came up through their own study process.
You know, you mentioned that it was hard to get a vaccine, but I've seen reliable data that says that in Colorado, only 38% of the vaccines in supply have been delivered. Why is it that people are not able to get vaccines? Are we just destroying the vaccine supply, or is it becoming exposed to high temperatures? Does anybody know what's going on there? Why is there such a small percentage that are actually getting the vaccine?
So I think it's going to be interesting to see that number over the next couple of weeks. Just because I think a couple of different things. One, I think everything moves so quickly that health systems and areas needed time to get processes in place. Like I know, like for us, like our vaccination rate over the last week, like increased exponentially just because we finally were able to kick systems into gear and get people in gear. The other thing you have to keep in mind is that people are vaccinating, like in order to vaccinate, you need someone to vaccinate. You need people to do the monitoring. It's a long monitoring period for a vaccine. It's a lot of things that we haven't seen before. There's a lot of paperwork that goes along with each of these vaccines because you have to account for every single milliliter of each dose and any waste. So I think it took kind of time to get well-oiled machines in place. And then you also have to keep in mind that the healthcare system's strapped right now. Like there's a lot of people dealing with staffing issues and things like that, just because COVID is obviously still a very real thing and impacting that as well. So I think, you know, you're using people to get the vaccines to still have other full-time jobs too.
Yeah, yeah. So it sounds like the bottlenecks will stay in place until spring or summer because you just can't train a new nurse to give a vaccine. There's a fixed amount of staff that's available, and it seems like that
Can
bottleneck.
employ the medical staff of the military, and that has not been done.
Right.
Exactly.
So, and I just want to, I need to let some of you don't remember this. I remember being taken to my gym in Wheat Ridge Elementary School and having this big hypodermic needle, and we were all in line, and we were all in second grade, and we all got a polio shot.
Yeah,
There was one
But at the
problem.
time, you didn't
But
have to. keep
man,
people 6
it
feet
was
apart.
fast, and the federal government was involved.
Yeah, I
Sorry,
think
what, Caitlin?
it's hard in this case because you have to worry about patient flow. You can't have like a mass people in a conference room because we have to keep everyone 6 feet apart in that conference room as well.
Well, you're right, but we do it in the grocery stores.
Yeah, I don't
No,
understand.
I think that part of it was we didn't get the federal government involved.
My
And using
sister
the National
in Florida
Defense Act
called
to
me
move things.
last night, and she and her husband had gotten their shots in their home. The paramedics came by and gave them their shots in their house.
Wow.
They never even left their house.
Where
And
was
I
this,
don't
Shelley?
understand how paramedics, how we could afford that, or how they could afford that. She said, I'm going to get mine at home.
Where do they live, Sally?
In Florida, right outside of Orlando.
If we're worried about social distancing, why couldn't we use Broncos Stadium? I mean, the football season's done for them anyway.
So Biden was talking about using stadiums and high school gymnasiums.
Yep.
That's kind of in the thought process, at least.
I was
Gotta
part
wait
of
another 10 days.
I was part of the staff for the H1N1 vaccination. Some of you'll remember when we did thousands of people at a time. We could not possibly have done thousands of people at a time and kept them socially distanced.
I think that each governmental structure, whether it's state or county or federal, has to have procedures put into place. And I think it's wonderful to hear about some of the effective ways vaccines have been delivered. And I believe that as within a few weeks, this whole process will be much more efficient and effective for all of us. But I really appreciate the information that Caitlin's giving us. Thank you for doing that.
Yeah,
Thanks, Caitlin.
I think it will continue to get better. And the other thing I think I want to call out, because I know it's frustrating with so many people wanting to get the vaccine. Like we see that on a day-to-day basis. And I know everyone wants it. And believe it or not, like everyone in healthcare wants everyone to have the vaccine too, because we want to see herd immunity. The one thing I will say is our state health department, I've been sitting talking to them like so frequently over the last couple of weeks as we've been working on this. They are absolutely incredible. They are a super small team. They are working around the clock. Like people are working so hard on this, and really they want it to be successful. So I do think we're going to see it continue to improve. People are working really hard on this. It's just something like everything with COVID. It's something just having to quickly operationalize things that are very new.
The other thing too that we really need to remember is that getting our shots is not going to be a get out of jail free card.
Yeah,
we still have to assume everybody else has it, or that we have it and we can give it to everyone else. There's so much we don't know. So we're still going to need to wear masks. We're still going to need to social distance. We're still going to need to stay home for a long time.
It is not a magic bullet.
And we don't know if the vaccine prevents transmission yet.
So, right. And we don't know how long it'll last.
Exactly.
Caitlin, thank you very much for all your information. You've been very informative and I appreciate it.
I agree.
Yes. Absolutely, Caitlin. Thank you.
Caitlin gets a gold star today.
Yeah, she does. Yeah, she does.
I'm worried. about how, wondering if there's a way we can get this information to more than just the 30 of us who are logged on right now.
Probably. If the whole thing, we're still being recorded, we could excerpt this and just say that there was a conversation about the COVID vaccine as part of Coffee Hour and just make that available. I can ask Dee Dee to do that. She goes through the recording and excerpts my sermon and excerpts the Faith Forum section, so she can go through and excerpt this.
I think that'd be very good.
Yeah. Yeah.
Thank you, Caitlin.
So,
Thanks, Caitlin.
Yeah, and just as a reminder to everyone too, that the Department of Public Health actually has a good website, CDPHE's website. They have a whole section on the COVID vaccine.
Yeah, they do.
So that is a great resource to anyone. And yeah, and Kathy dropped the Colorado website too into the chat. So that is a really good resource. This information on COVID vaccine changes pretty much, I mean, daily, hourly, but like it changes so quickly. So that is a good website to go back to. Just because what we talked about today, who knows if by next week that'll even be accurate anymore.
all right. Well, thank you so much.
Yes.
If people want to hang around and talk about saints, that's what we're going to shift to now. If not, we'll look forward to seeing you all sometime in the next week. At one point or another, stay safe, stay healthy. If you can get the vaccine, do it. Pray for our country and all of that other stuff. So anyway, great to see you all. Thanks again, Caitlin. That was great.
Thanks, Caitlin.
Thank you.
Take care.